Today's presentation will be about ultrasound by Maribel Roman, me. A little history of ultrasound. Ultrasound in the medical field started in the 1942s. In the 1950s, it got more easy to develop the practical technology and application. In 1966, it was allowed to measure the velocity of the blood flow due to the new pulse Doppler ultrasound. In 1970s, the scans were now developed instead of the basic lines. Now the scans would come out to be grayscale imaging. What is ultrasound? It shows structure inside your body using high-intense sound waves. It is used for pregnancy or diagnosis conditions. It can be for abdominal ultrasound, breast ultrasound, and transrectal ultrasound. It is painless imaging test and safe due to not using radiation. Ultrasound creates real-time pictures or even videos. Ultrasound can also let you know any inflammation inside your body. What are benefits of ultrasound? Benefits are zero radiation, real-time imaging, more affordable, requires no recovery time, and doesn't take a long time for imaging. Non-benefits. It's very poor when it comes to deep tissue depths. Depends on how well is the skill of the tech, and poor on penetrate bone or air. These are the ultrasound images: the early pregnancy, pelvic imaging, and knee imaging. What kind of ultrasounds is there? Most people, what they don't know is that there is, 3 different ultrasounds: 2D, 3D, and 4D. 2D stands for two-dimensional. It's the most common type of ultrasound imaging healthcare providers use. It produces a flat imaging of your organs and internal structures. 3D stands for three-dimensional. This type produces more detailed images and shows better angles that the second D ultrasound can produce. 4D stands for four-dimensional, which is ultrasound in 3D but in motion, which is, you can think of it as a 3D live image. What happens during an ultrasound scan? For example, ultrasounds involving transducer over the skin. First step, lay on your side or back depending on what it needs to be scanned. Second, the tech will have to apply a small amount of water-soluble gel on the area that would have to be scanned. Third, the tech will grab a probe over the gel to get the images to show. In this occasion, you'll have to hold your breath for seconds to get a clear view. Lastly, if there was a clear image, you will wipe off any remaining gel and be done. And these are my citations, and that will be my presentation. Thank you for listening and watching.